Assalamualaikum warahmatullahi wabarakatuh. Good afternoon. First, I will introduce myself. My name is 𝚙𝚛𝚎𝚜𝚕. I'm a student at 𝚙𝚛𝚎𝚜𝚎 University, Banjarmasin. In this question, I will present the result of my case study. The title is Maternity Care and Independent Postpartum Isolation for COVID-19 Positive Patient at Tamban Health Center. Case study. Background: Indonesia is still experiencing the COVID-19 pandemic. Cases of positive COVID-19 still show in increase. This has an impact on healthcare sector policies that limit routine services, including maternal and child health services. Midwives, as health workers who help women go through their life cycle. Childbirth and postpartum are part of a woman's life cycle that must be managed by a midwife. Indonesian Obstetric and Gynecology Association (POGI) issued a number of recommendations in handling pregnant women and women giving birth, where delivery must be carried out in health facilities such as health center, midwife, and hospitals during the COVID-19 outbreak. This is expected to reduce the risk of transmission to prevent maternal morbidity and mortality. Method: primary data collection in the form of physical examination result interview, while secondary data is based on literature and documentation. In this case study, the researcher states the validity of the data. 1. Triangulation of sources, checking the validity of Mrs. M from the recording register at the Tamban Health Center, information on the midwife on duty and family member, husband. Number 2, observer triangulation is done by checking the validity of Mr. Data M by reporting all examination results that have been carried out the assistant lecturer at the Tamban Health Center so that the information collected is clear and reliable. The purpose of this study was to carry out delivery care and self-isolation for COVID-19 positive patients at Tamban Health Center but using midwifery care management according to Varney and the recommendation of the SUIP method. This research was carried out from 16 until 30 May 2021, starting from childbirth care to 14 days of self-isolation during the puerperium. In short, midwifery care in childbirth was carried out one time and monitoring of independent isolation as well as care for postpartum mother was carried out 3 times. On May 16, 2021, Mrs. M with GPA came to the puskesmas without doing a rapid swab test, even though the mother had been advised to do an examination for duration and antigen. Examination was carried out at the 𝚙𝚛𝚎𝚎𝚜𝚎 health center. Is what found that the patient was positive for COVID-19, so the midwife used level 3 personal protection equipment. During the delivery care process went smoothly until the baby was born, which was carried out according to the procedure. After the delivery stage incomplete, the midwife cooperates with the COVID team to carry out a PCR swab examination, and further examination of the sample is sent to the South Kalimantan Provincial Health Laboratory. At 8 hours postpartum, the results of the PCR swab examination were positive. Midwife provide health education for postpartum mother to be able to undergo to postpartum period and self-isolate at home for 14 days, especially teaching mothers how to care for themselves and their babies by implementing health protocols, namely maintaining distance, using masks and washing hands, monitoring for 14 days of self-isolation as well as for postpartum care, interaction between midwife and postpartum mother are carried out online. Discussion. Mr. Miss Mr. M came to the health center in a state of labor and had never been tested for a rapid test. This is based on the task force for the acceleration of handling COVID-19 2020 with guidelines regarding delivery services where rapid tests are mandatory for pregnant women before giving birth. Under the conditions, the mother was immediately subjected to a rapid swab test. Positive pressure we obtained, so the midwife provide assistance with level 3 and preferred referral. This is supported by the guidelines met by the task force, the acceleration of handling COVID-19 2020, which set the pregnant woman, maternity mothers, and newborn in an emergency outpatient under supervision (PGP) status or confirmation COVID-19 must be referred to a hospital, the nearest COVID-19 referral hospital or phonic capable hospital. However, in the process of preparing for a referral, the patient has started to train so that delivery of a positive patient with COVID-19 must be carried out at the Taman Health Center. The sign of labor aspect Nurasi 2014 can be seen in Mr. M's case, such the occurrence of labor with waist pain that radiated forward, which is discharge accompanied by blood through the vagina, discharge due to rupture of the membranes. Likewise, the delivery process experienced by Mrs. M, which lasts the 28 minutes without problem and complete complication, according to Nurasi 2014. That delivery in multi-woman is 2 hours in theory, Sukarta and Rosmawati 2019. To be able to reduce the risk of perineal laceration, it can be done by lying on the left side, making it easier for the mother to rest between contraction if the mother is tired. The entire process of childbirth from the second step to the fourth stage is carried out according to the rules of infection prevention, according to a fixed protocol. Health workers comply with the principles of hand hygiene and physical distancing at all times. As for the isolation of handling COVID-19 2020. The third stage lasts for 11 minutes from the time the baby is born. This is accordance with the theory that the third stage is also referred to as URI, which usually lasts between 5 until 15 minutes. 𝚙𝚛𝚎𝚜𝚎 2019. Postpartum monitoring each hour postpartum informs the result of the examination to the mother and family that the mother's condition is positive for COVID-19. Midwives advise mother to self-isolation at home. Provide psychological support to mother. Teach mother how to take out the babies to maintain health protocol for mother who are positive for COVID by using masks. Teach mother good breathing technique. Teach the mother how to do umbilical cord care. Advise the mother to keep the baby clean. Advise the mother to keep meeting her nutritional needs. And advise the mother to keep getting enough rest. Postpartum mother who are positive for COVID-19 are still given postpartum care, but with the implementation of strict health protocol and communication between midwife and patient is carried out online. During the puerperium, it can be lived without complication. The mother can also accept her condition so that the postpartum period runs smoothly. Postpartum Postpartum period runs smoothly. Postpartum mother and babies observed to be healthy. The implementation of strict health protocol meant that when the 14-day isolation period is complete, the postpartum mother is declared negative for the COVID-19 virus. The success of the implementation of midwife very care during childbirth and the postpartum period for positive COVID-19 patients until the disappearance and of the COVID-19 virus based on the result of the examination after undergoing a period of independent isolation is due to good cooperation between the sector, health workers, midwives, postpartum mothers, and families. Conclusion. The conclusion is this study is that maternity of postpartum patients who are positive for COVID-19 must still be provided with service according to midwife care procedure in collaboration with protocol for midwife and patient. Thank you. Thank you for your attention. I'm 𝚙𝚛𝚎𝚜𝚎. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon.